Hello everyone, my name is Maurice Nelson, your host and founder of Child Issue. Welcome to this month's edition of Child Issues. All right, so we hold these sessions every last Saturday of the month. Keep a date with us on every last Saturday of the month. We're going to come here on this channel. You will see us, solving one problem or the other, right? So about the child and every other thing concerning the child. So trust me, this month is a massive month, and in this month we're having great people amongst us, and April has amazing things in stock for us. And don't forget, I am Maurice Nelson, your host and founder of Childish. So we thought it wise to bring this program to you in this same month, in the month of April, so you get to know about autism and how you can help autistic children around you, and autistic other people as well. It's not just children that are autistic. So we're going to be doing a lot on this channel. Today we have with me Dr. Asima, and we also have with me Glory Joseph. So I'm going to let them introduce themselves right now.
My name is Favor Asima Jonas. I'm a medical doctor by profession, and I'm delighted to be with you all on Childish today.
Hello, my name is Glory Joseph, and I am a final year medical student in the University of Calabar Teaching Hospital, Calabar.
All right, so thank you very much, Glory. Thank you so much, Asima, for joining us in this session. We are so grateful to have you around us. We're so grateful to have you in our studio. We trust that your knowledge and your wisdom is going to help us, navigate around what autism is and how we can help autistic children around us. So don't forget to stay with us, because I know you're going to be learning a lot. And this is the kind of content you like. You can click on the subscribe button and also click on the notification bell to make sure you get notification on anytime we drop any good video like what you're about to watch now. What you're about to experience now is a life-changing experience. So all right, so I'm going to be explaining what is autism. So I'm trying to give you a brief background on what autism is. So what is autism? I don't know. So that's why we brought all of them, right? So I'm an architect. I mean, I do know a lot of things about autism. So I have someone who's going to be explaining what autism is to us, and she's going to be telling us what autism is and how we can navigate autism. So Asima, over to you.
This month, the month of April, globally is the month for autism awareness, and I celebrate Maurice for the amazing work he's doing on Childish. So today I'll be discussing and enlightening you all on autism spectrum disorder. Globally, about 1% of children, that is one in every 100 children, are living with autism. Now, it is a spectrum, and it has different layers in it. So we have people from the mild end of it, and others at the most severe end of it. There's the classical autism and the Asperger syndrome and other mild form of autism. Now, you can ask, what is autism? Actually, autism is a spectrum of neurodevelopmental disorder that affects communication, social interaction, and behavior. It is usually diagnosed in children before the age of 3 or at the age of 3, generally. Now, what do I mean? So, autism is a disorder affecting the normal development of the brain. Yes, normal development of the brain, which will lead to the child unable to achieve some major milestones. So when the child is supposed to speak, the child is unable to speak. Yes, so leading to communication abnormalities or disabilities in communication. Yeah. And then it could also lead to difficulty in social interaction, just like everyone interacts with each other, understand people's feelings, and speak accordingly, or they take into cognizance how people react to things. So this determines what you say and what you don't say, and you're able to understand both verbal and non-verbal communication. Children or people living with autism are unable to draw this line, so they have difficulty in social interaction. Then there's also behavioral abnormalities. So you see them behaving in a particular manner, some in a repetitive manner. This is one of their coping mechanisms and one of the signs of this autism. These developments can be revealed in the form of their social interaction, so that they are unable to interact socially with their peers, to understand people's emotions. Yeah, it can also affect their communication, both verbal and non-verbal communication, and it can also affect their behavior, how they behave. So that is autism. Actually, it's a spectrum, meaning it goes from, there's point A to point Z, for example, and there are different spectrum, having A as a mild form and Z as a worst form. So it can go through that spectrum, and any child can be found in any of these spectrum.
Thank you so much, Asima. So I'm going to be telling us, some nine myths about autism. Nine myths about autism. So I'll give the first three after my session, and after Glory's session, I'll give another three, and then that's how we're going to just distribute it that way. Don't forget, you're welcome if you're just joining us. Thank you very much for joining us on this episode of Child Issues. So here are nine myths about autism versus their actual reality that I would love to share with you. So I'll share four. Okay, no, I'll share three, and then I'll share three intermediately, and that's how we're going to do. So, first of all, what's the first myth? Myth number one: autism is a mental illness. The reality of this is autism is a neurobehavioral developmental order, right? It's characterized by challenges with social interaction and communication. It is not considered as a mental illness, right? I know you got that. So number two, people with autism are intellectually disabled. That's a lie. The reality is that 44% of people diagnosed with autism have average or above average intellectual abilities, and some may excel at mathematics, they may excel at music or another pursuit, while there are other individuals for whom learning is difficult and for whom progress will be slow. Autism can bring it just as many exceptional abilities as challenges. So number three now, people with autism are all alike in their symptoms. The reality of this is that autism is a spectrum disorder, right? It's ranging in severity, and the challenges posed by each autistic individual are very, very different.
What's the characteristics of a child who is living with autism? How would you identify this child? What are the symptoms you may find in this child?
So knowing about autism is not enough. We must also know the things, signs and symptoms that we can easily look out for in children so that we can get help for those children. This is the essence of the awareness on autism, so that you could identify children that are in need of help and you can give them the help that is needed, or you can refer them to a place that can give them the help that they need. So we'll talk shortly about certain signs and symptoms that you can see in a child, and you know that this child might be autistic, because obviously the diagnosis of autism is clinical, and so by your observation you cannot just make a diagnosis of autism. Yeah, so some of the signs and symptoms that can be seen at an early age in a child that has autism includes the absence of a social smile at the age of 6 months. Normally, children should achieve a social smile within 2 months to 3 months of age. So if a child has gotten up to 6 months of age and has not yet achieved a social smile is a smile that is achieved from or elicited from a child without any external stimulation. So it's merely a facial response. So you smile at a child and the child smiles back at you. That's called a social smile. So if that has not been achieved by 6 months of age, then you can say that this child might be autistic, or this child might need further examinations, further neurological examinations, to rule out if the child is or is not autistic. Some other things are the absence of babbling or cooing. So the child is not babbling, the child is not cooing by 12 months of age, then you might want to take the child for a neurological examination. Also, if the child is not saying, the child is not gesturing, there are no gesticulations, the child cannot wave bye bye, the child cannot gesticulate come or go or do any hand gesticulations for common phrases, then the child is also expected to begin saying single words. And if the child does not do that before 16 months of age or at 16 months of age, then you should take the child for neurological examination. The child might be autistic. If there is any social or language failure at any point in the child's development, maybe a child that previously used to play with his or her mates and suddenly is withdrawn, you might want to take the child for neurological examination, because this might be a telltale sign of autism. Another sign is that of restricted interest. So for children that are autistic, they tend to have a limited range of options to them. Yes, there are lots of options available, but they tend to stick to what they have chosen. So this is akin to saying they have repetitive behaviors. But in this case, they are not just repeating behaviors, but they are sticking to certain behaviors. So they don't like to do a lot of things. If they say they like to play football, they only like to play football. And it may interest you to know that a lot of people that are geniuses are actually autistic. So this is an advantage for them, because you know that as Malcolm Gladwell speaks of in his book, he says that there's something called the 10,000 rule. So a person who has rehearsed and done something over time, mastery comes by rehearsing and doing something for about 10,000 hours. That's a rule, it's a principle, right? That has been found with a lot of people that are geniuses in certain areas. So for these people that are autistic, it kind of serves as an advantage to them, because they enjoy repetitive behavior. So it's not a task, it's not an arduous task for them to keep repeating something over and over again, and this serves as an advantage. So sometimes they turn out to be math prodigies, right? They tend to win competitions and that kind of stuff, because they put in certain number of hours. So they are able to keep going at a task over and over again without getting tired easily, because they like to stick to certain activities. So they just pick one activity and keep doing it over a long period of time. They can have Tourette syndrome, which is characterized by several fits, that is muscle groups contracting in the body and moving irregularly. They can have intellectual disability also. So any out of all these things could occur in a person who has autism. And besides the fact that genes are responsible for this, I think it's worthy of note that environmental exposure also plays a major role in this, because a person might have a certain gene but is not in an environment that allows for the expression of that gene. So if a person is exposed to a certain environment that causes the over or under expression of a certain gene, it could result in these conditions. Also, in the diagnosis of diseases, we have something called a disease symptomatology. This means that if you look at the symptoms that are found in a certain disease, you can't say that if you find a person that has these symptoms, then this person has this disease. So the disease symptomatology for autism and these conditions, some of these conditions I have mentioned, actually overlap. So this is why these conditions sometimes occur together in a person that has autism.
Okay, so now you've heard the symptoms of autism. So I'll be giving you also, the second three, right? The second three of the myth I was talking about. So let's go. Number four. Don't forget to just joining us. Thank you very much for joining, and don't forget to like, subscribe, and share this video to as many people as possible. So let's go straight to number four. Children with autism are disobedient kids. I laugh when I hear this, because the reality of this is that children with autism may seem disobedient because of their struggle with communication, right, and also with social skills, so which may make it difficult, to interact with peers or understand instructions. So myth number five: autism is caused by bad parenting. That's a very, very big lie. So the reality in this is that in the 1950s, a theory called the refrigerator mother hypothesis arose, suggesting that autism was caused by mothers, right? Mothers who lacked emotional warmth. But you see, this has long been disapproved. Yeah, it has been long been disproved. So while bad parenting does not aid any child's development, it will not cause autism, right? So the myth number six is this: autism is caused by vaccination. So the reality of this particular one is that there is no scientific evidence to support this belief. Autism is complex and seems to be caused by many different combinations of genes and also environmental influences, as also explained by Asima. I guess you're enjoying the scenario, so let's welcome Asima as she takes us on the causes of autism.
One may ask, what exactly is the cause of autism? Now, the exact cause is unknown, but it could be genetic. That is, if a person has in his or her family, there's a history of autism. So there's a risk factor of having a child with autism. In fact, there's the family I spoke about earlier on. Yes, this family, their father was autistic. He was born as a child living with autism. And by the time he got married and they had about four kids, three of those kids were autistic. So family history plays a strong role in the development of autism. The next is environmental factors. A mother can be exposed to certain chemicals which can lead to certain chemicals during pregnancy which can lead to the child coming down with autism. Yes. Finally, development or structural abnormality. So there could be abnormal development of the brain of this child.
All right, Dr. Asima, thank you so much for that insightful understanding on the causes of autism. So now, let's go into something very important. As you're here, this is a kind of content you like. Don't forget to subscribe, don't forget to share this, and don't forget to also, like this particular video, as it's going to make us, it's going to help us to reach out to many other people, right? So thank you so much. Let's welcome Gloria as she takes us, as she gives us, as she exposes to parents and caregivers on what they are going to be doing, or the signs they're going to be seeing to make sure that they take care of their autistic children.
There are certain signs that caregivers and parents can look out for in their children, which would tell them that this child might be in need of a neurological examination, and that is what we'll be looking at shortly. So for these children that are autistic, they sometimes have a social impairment. Like I mentioned earlier, I said that autism is a neurodevelopmental disorder that affects social and language skills, right? So for these children, they might have social impairments. This means that for most of them, they are unable to understand social cues, they are unable to socialize, so they might be withdrawn and they might not want to play with their mates. So they don't also want to be found in public places a lot of times. Something else that can happen with these children is there's something called repetitive behavior. So for autistic children, they like to play in patterns. Maybe if they play at a certain place at a certain time, they like to repeat patterns. So if you look at a child's life and you see a lot of patterns repeating, you can see that the child likes to do things in a certain way, and if the child is taken away from that pattern, the child tends to throw tantrums, or the child is not at ease, the child cannot fit in. If the child is not in that particular environment, then this might be a sign that the child is autistic.
The last three is here, right? That's number 7, number 8, and number 9. So who's ready to hear this? If you're ready to hear this, try to share the video, try to like, and try to subscribe. Hit on the subscribe button, and also turn on your notification bell for you to get all of this wisdom as you want to get them. So I'm not going to be telling you number 7, 6, number 7, 8, and number 9. I'm not going to be telling you that. So let's go back to Asima. Oh, sorry. I'll give it to you, right? I'll give it to you. It was a promise here. I made a promise. I'm going to make sure I keep my promise. Number 7. Number 7 is this. People with autism don't feel or express emotions. The reality of this is that autism does not prevent an individual from feeling and expressing the same kind of emotions you feel as a normal human being here. It just makes the individual communicate his or her emotions and perceive your expressions in different ways, right? So that's the explanation for that. So number 8, the myth number 8 is this, that autism only affects children. That's a very big lie, because if there's an autistic child, then they'll always grow to become adults with autism. Yes, that's true. So number 9th one, which is the last one, is that there is a cure for autism. The reality, which is what Asima will be talking about immediately after this, is that there is no medication that can cure autism spectrum disorder or treat the core symptoms. While some behavioral based programs may have positive effect on some children with autism, this needs to be careful tailored to the child, as all children with ASD will have their own needs and learning. So Dr. Sima is going to enlighten us more on the treatment of autism.
And now you may be tempted to ask, is there actually a cure for autism? could there be a time that my child will grow out of this? If some people actually say they will grow out of it and all. Is this really true? Now, remember we said that autism is a neurodevelopmental disorder, and for now, there is no cure, there is no known cure for it. But there are therapies that can be done to better assist these children in developing different aspects of their life. These therapies include speech therapy, where they are taught how to speak, yeah, speech therapy. Then there's applied behavioral analysis, ABA, floor time. This is the time where they get to understand social interactions. Then there are other therapies such as relationship development intervention, RDI, and parent-child interaction therapy. So all these therapies are available and put in place to help the children living with autism understand to a degree and develop to a degree some of these skills that they may be lacking in order to improve their well-being and their state of life generally. So in conclusion, it is important to note that not that each child is different. Hence, the therapy should be streamlined to meet the needs of that child. But generally, the society and the family should understand that these children only have special needs and they are no different from other children.
So, my final words to parents of children who have autism and to children who are autistic is that autism is not a death sentence yet. Autism does not have a cure, but identification is key, and there are lifestyle modifications that can be put in place to ensure that the individual lives a healthy life too. So, people that have autism are not outcasts in society. You have an advantage if you are autistic. Understanding yourself, people that are autistic should take out time to understand themselves, because understanding themselves is key in getting the most and making the most out of their lives. You can still go on ahead if you are autistic, or if you have an autistic child, that person can still go on ahead to live their best lives and still shine. There are a lot of geniuses that have harnessed the power that is in autism. I do not believe that it's a disability. I believe that it's a special ability. So if you look at it as a special ability instead of a disability, you are strengthened and encouraged to explore the limits of your special ability and see as much as you can do and as much as you can do. There is no limit to your greatness. Thank you.
Thank you so much, Glory, for those last words. Thank you so much, Dr. Smart, for those last words. Don't forget, every child is a gift, every child is special. So you need to do what treat them as one. So that's why we know. One of the reasons why we put up childish is that we always like to tell you that every child is special, and every child is. It doesn't matter whether a child is autistic or not. We don't care. What we need to what we are trying to the values we are trying to instill in parents and adults around us, that they should treat every child equally and make sure that every child deserves the treatment, gets the treatment that they deserve, right? So in childish, we solve all of these issues, all of these problems, and we give practical solutions to all of them, right? So I want you to stay and enjoy yourself in this session. If you have your questions, you can ask your questions, and we'll be right here to answer you in the comment section. Have a wonderful day ahead. Have a wonderful weekend ahead. May is going to be promising. May is going to be awesome for us, and other videos are going to drop about autism. And I urge you that you should watch and share, and also like and make sure you share with your friends. So have a wonderful weekend ahead, and don't forget, every child is a gift. Every child is special, and you need to treat them as one. I want to say a very big thank you to our guest. We give a big thank you to Dr. Asima. With our busy schedule, she has to come make these videos for us to be able to put them together and bring them to you. And also to Glory, thank you so much. To all your busy schedule, you had to make sure that you put out the video to for us to put it up together and bring it out here. So thank you very much on behalf of the leadership of Childish. I want to say thank you. Don't forget, I'm Maurice Nelson, your host and founder of Childish, and I love you, and I love you, and I love you, and there's nothing you can do about it. Bye.